Do you have a patch of hair loss anywhere on the scalp, or do you have a patch of hair loss on your beard? You feel that hairs were present previously, but it suddenly starts disappearing all of a sudden without any cause. Well, you might be suffering from a condition called as alopecia areata. Welcome to my YouTube channel. I'm Dr. Pratik. The word alopex is derived from the Greek word which means fox. Now, many foxes used to have patches of hair loss on them. These patches were very discreetly spread around, and sometimes they used to be merged with each other, forming a larger patches. A similar pattern used to occur in the human beings, and the previous observers have given this name, that is alopecia areata. Areata means small area of loss. Though it seems to be an innocuous condition, but it can be associated with many other disorders. The basic pathology behind alopecia areata is that your own immune cells are trying to attack your hair follicle. In the hair follicle, normally we have something called as immune privilege. The main cells present in the hair follicle are keratinocytes, and these keratinocytes produce various inflammatory mediators which suppress the normal immune system locally, so that our own immune system doesn't attack the hair follicles, leading to hair loss. Due to various reasons, this immune privilege is lost. Once this immune privilege is lost, body detects the hair as a foreign material and mounts an immune response against it, due to which there will be hair loss. But one good condition about this hair loss is it is not permanent, that is, it is temporary. This is a non-scarring type of alopecia. Once you suppress the immune system, the hairs will come back. Even if the immune system is not suppressed, even if no treatment is given, most of the alopecia areata will recover on its own. There are many causes of alopecia areata, and the number one factor is stress. Other causes can be idiopathic, and usually this alopecia areata, being an autoimmune disease, is associated with other autoimmune diseases such as vitiligo, diabetes mellitus, hypothyroidism, and hyperthyroidism. Other autoimmune diseases such as autoimmune blistering disorders. All these autoimmune disorders, there is one common defect. They are trying to attack their own body, thinking that it is a foreign material. And the same thing happens with the alopecia areata. So how do we diagnose alopecia areata? For seeing a patient with a patch of hair loss, we try to examine the skin. We rule out if there is any scarring or is there or not. If there is no signs of scarring, then we evaluate the patient to search for any other autoimmune conditions. And if you are able to find any autoimmune conditions, both the alopecia and the autoimmune conditions will be treated. So the prognosis for alopecia areata is good, but there are various stages of alopecia areata, and various stages have different prognosis. If there is only mild patch of alopecia, we call it as patchy alopecia areata. If the total hairs on the scalp is lost, we call it as alopecia totalis. And all the hairs on the body are lost, such as eyebrows, beard, and body hairs, and even the scalp hairs. If everything is lost, then we call it as alopecia universalis. And based upon the pattern of hair loss, we are having a sisyphus pattern, that is snake-like hair loss extending from the occiput to the temporal region. And Euphiasis pattern, that is opposite of sisyphus, that is hair will be present only in these parts, and other areas it will be lost. And reticulate pattern, that is diffuse patches of hair loss. So alopecia areata is one among the causes for hair loss, but there are many other causes of hair loss which needs to be differentiated from each other and treated accordingly. So what can be done for this alopecia areata? So most of the alopecia areata will resolve on their own within a duration of 1 year, even without any other treatment. Home remedies can be done, such as reducing the stress levels, following a healthy diet, taking proper sleep, avoiding processed foods. These all can be done as home remedies. If it is a mild stages, we usually give minoxidil. Minoxidil has better results. If the patient is not responding to minoxidil, then we have to give oral immunosuppressants and topical immunosuppressants, and other treatment modalities such as irritant contact sensitizers. How this works is we apply an irritant to the affected area. The body tries to mount the immune system to the irritant so that it forgets about the hair. This is one of the unique ways of treating alopecia areata, but it comes with its own side effects, and it needs to be done in a monitored manner. And if there is any confusion regarding alopecia areata, even a biopsy can be done, where we can see the inflammatory infiltrate surrounding the hair follicle, which confirms our diagnosis of alopecia areata. So, well, this is about alopecia areata. If you want to learn more about the structure of the hair and the hair cycle, you can watch this video. Thank you for watching this video. Do like, share, and subscribe for more videos like this.